All right, and also another big day. It's December 1, and it's World AIDS Day today, and we saw that 98,960 persons, residents, are living with HIV/AIDS in Anambra. Of course, this is not just Anambra State, but of course, when you look at the statistics around the world, in Nigeria too, is yet another reminder that more needs to be done to protect everyone, and even those who are living with the scourge of HIV/AIDS. Of course, it's not a death sentence.
True.
The activists keep saying, but then they still need to protect these patients, these persons living with HIV/AIDS, and above all, prevent the spread to people, babies, and the like. Right. We'll take a break now, and bring in some more reports, and then we'll continue with more on TVC Breakfast. Please stay with us.
The number of recorded cases of violence against women and girls has largely remained unchanged over the last decade. It has been considered as the most widespread and pervasive human rights violation worldwide, affecting millions. In 2021, nearly 1 in 5 women aged 20 to 24 were married before turning 18, and more than 5 women or girls are killed every hour by someone in their family.
For us, it is not just about the 16 days of activism. It is a year-long campaign to raise awareness and advocate against gender-based violence, so people will know first what GBV means and what they can do to protect their words, those within their sphere of influence, and beyond that, to also prevent GBV in their workplaces, in their homes, within their community.
They agree that a lot more needs to be done to change the tide in order to ensure that women and girls are heard and they get access to help when they need it. But this has been largely limited by the lack of effective gathering of data and justice.
It is critical that perpetrators are brought to justice quickly, that women have access to justice, and perpetrators are put to justice, and if convicted, rightfully put in prison. So the role of justice is a key one.
We don't gather enough data. We don't have data that's continuous over a spectrum. So even if it's reported, it's difficult to find what happened later on.
Gender-based violence remains a systemic crisis and a global public health, gender equality, and human rights priority. The health impacts of violence can last a lifetime, affecting both physical, mental, sexual, and even reproductive health. Kemi Balogun, TVC News, Abuja. Tuberculosis remains a public health problem in Nigeria, with more than 450,000 infections recorded in 2020, alongside more than 155,000 deaths. To eradicate this disease, there is an advocacy to increase the sustainability of the response across board in order to reduce the burden. Many people who may have tuberculosis are unaware that they have it. Others are limited by the lack of awareness, while those who know remain silent due to the stigma they may face. This consultation meeting between the public and private sector actors is opening up the platform for collaboration that is expected to improve access to TB services and resources.
Once you are infected and you are diagnosed, you can be cured within 6 months, and the person will be free, from TB. We know that if somebody in the community has TB, is capable of transmitting it to so many other people. So that awareness creation is important. Intention is to engage the private sector, to also contribute their own quota in the TB control in Nigeria.
What drives tuberculosis at the moment now is stigma. It's very important for us to know that most of the cases of active tuberculosis may have been infected with the bacteria for a long time. And because the person has a very strong immunity, it wouldn't show.
The group believes a multi-sectoral approach will help to provide better diagnostic tools that could cause a reduction in the numbers of TB infections, including for latent TB.
About 80% of Nigerians first seek healthcare from the private sector before moving on to the public sector. So it's important that we are able to get or catch those cases at that place.
The National Tuberculosis and Leprosy Control Program says the country achieved an 89% TB treatment success rate in 2020, 43% of TB treatment coverage in 2021, and has recorded a 17,600 drug-resistant TB notification in 2022. Kemi Balogun, TVC News, Abuja.